very much for your patience, everyone, and welcome. I am Sarah Rosen-Wortel, and I have the great privilege of being the president of the Urban Institute, and today of welcoming you to this terrific virtual event, part of the capstone of a really extraordinary and important project. But before I jump in, I want to make a few notes of housekeeping. This event is being recorded, and the recording will be posted online afterwards if you or your colleagues missed anything. Speaker bios and related materials that may be referenced are all available on the web event page online on our website. And all of our participants are muted, but we hope you can join the conversation. You can type your questions or comments into the Q&A box at any time. Other part of the preliminaries are a few thank yous. First of all, my thanks are to you for taking the time to join us here today and to learn together from this work. Most special thanks to the Arnold Ventures for funding the Prison Research and Innovation Initiative, which is the work behind this webinar series. My deep appreciation to David Pitts and Evelyn McCoy for leading PRE as principal investigators over the last few years. And finally, let me just note that today's conversation is part one of a two-part series that will be sharing the findings from PRE more generally. And the second one will be next Thursday, September 11th at 1 p.m. And we encourage you, Eastern Standard Time, to attend that one and share news of both of them with others. So before I hand this over, I want to just spend one moment talking about why we believe this topic is so important. Although I note that I am speaking to an audience that probably knows why this matters more than most. You know, prisons in America house more than 1 million people, and they employ over 180,000 individuals and taxpayers who invest. Individuals and taxpayers invest a significant amount of our public resources in their operation. I'm sorry, excuse me 1 second. Can I just say to the team, can we bring down the slides? I think that's probably now that we're done with the housekeeping. Thanks. Yet despite the scale and the impact of these institutions, they are among the least transparent and most understudied public institutions in our country. Since 2019, the Urban Institute has been in a terrific partnership with departments of corrections and local research partners, some of whom you'll hear from today, in 5 states to expand data transparency in prisons and to support innovation that is designed and based on both the experience and ideas of both incarcerated people and the correctional staff themselves. We have learned so much from the PRE initiative over the last 5 years, including some of the tough realities of the difficulty of conducting research in prison environments. The work actually launched just as the pandemic began, which also further challenged the work, and it's why we're so very proud of all that's been accomplished. At Urban, we believe that data collection and research are critical to transparency and accountability, and ultimately to improving the lives and outcomes for all who touch these systems. We need to know more, not less, about our nation's prisons and how to improve their humanity and effectiveness. And we believe that it's critical to bring together not just research and data, but also the experience of those who are living and working in our prisons to develop evidence-based and experience-based practices to advance these goals for everyone who comes in contact with them. So we're really glad that you took the time to be with us today. And now I'd like to introduce Evelyn McCoy, who is the Principal Research Associate at the Urban Institute and one of the co-PIs on this. She'll talk a little bit about what we learned from PRE, about living, prison, and working conditions from climate surveys that were administered by our local research partners in all 5 states. Thanks again, and over to you, Evelyn.
Great. Thank you so much, Sarah, for the introduction and for welcoming our attendees today. My name is Evelyn McCoy. I'm a Principal Research Associate in our Justice and Safety Division at the Urban Institute, and I've had the pleasure of working on this initiative for the past 6 years that it has been active, and then leading it for the past few years, alongside David Pitts, my colleague. And so first, I'm going to provide a brief overview of the Prison Research and Innovation Initiative. So this is a 5-state initiative, and we have representatives that are going to join us after this presentation for a panel discussion from some of those states today. And really the purpose of the project was to establish a model of transparency, accountability, and innovation in state prisons. And so you'll see here on the map that we have highlighted in blue are states that are participating. And so that includes Colorado, Iowa, Missouri, Delaware, and Vermont. And the core of this initiative was the work of local research partners with 5 state prisons and their respective departments of corrections to conduct community engagement and participatory research with both incarcerated people and with corrections staff. And it's very important that we focused on both of those populations to understand their distinct experiences within a similar prison environment. And one component of the research that was conducted by the local research partners were these annual climate surveys of both populations to understand their perspectives around prison living conditions and then also prison working conditions. And so what we have learned from these climate surveys across sites is going to be the focus of this webinar today. Before I jump into the climate survey data, I just want to give a tremendous thank you to the local research partners at each of the 5 sites. These include the University of Delaware, the Iowa Department of Human Rights, University of Missouri, University of Delaware, and University of Vermont. And so these local research partners led all of the data collection on the ground, the community engagement, the participatory research work, and they're the ones to be credited with all the fantastic data that I'm going to be reviewing today. And so Urban, we served as a coordinator and technical assistance provider throughout the initiative. But in terms of the analysis that I'll be presenting today, that was secondary analysis that we've been doing on the data that was collected by local research partners. So in terms of the data, each research partner conducted 3 waves of climate surveys in each of their 5 state prisons. And so they did 3 waves of surveys for incarcerated people and then 3 waves of surveys for correction staff. So each research partner did a total of 6 surveys locally. And these surveys had about 30 cross-site questions across the sites, and this was alongside site-specific questions. And the reason behind these cross-site questions was so we could do cross-site analysis and have the information that will be presented here today. And the 3 waves of surveys were administered between 2021 and 2024. There was a little bit of variation in terms of which year. For instance, it might have been late 2023 or early 2024 for wave 2 in one of the sites, but largely sites, the surveys were administered around the same time and within this time frame of 2021 to 2024. So across all 5 sites and 3 waves of surveys, there were over 5,200 respondents that identified as incarcerated people. And then we had over 1,700 respondents that identified as corrections staff. By corrections staff, we're including people who are non-custodial staff. So anyone who works within the state prison that was identified where the research took place. And this gave us a sample of a little over 7,000 respondents. One important caveat, though, to note is that we don't know how many unique individuals participated in the surveys, as that was very challenging to track. And during the discussion, we're going to get into talking through a bit of those nuances. So the cross-site survey questions that local research partners were asked to incorporate were grouped into different domains. And some of these domains and their respective questions were asked to both incarcerated people and corrections staff. And those include these ones on the screen: purpose of prison, prison conditions and environment, perceptions of personal safety, correctional staff and practices, and questions around the responses to the COVID-19 pandemic. There were also questions that were asked solely to incarcerated people, and those were around prison activities and then contact with family and friends. This contact with family and friends was particularly around what that contact looked like prior to COVID, given that COVID greatly disrupted prison operations and visiting specifically. And then there were a few domains that were asked solely to corrections staff, and those focused on interactions between staff and incarcerated people, perceptions of those interactions, views and reflections on workplace culture, as well as indicators of job satisfaction. And so some of these are the ones that I'm going to be going over today. We couldn't get through all of them as it's a lot of data, but we encourage you to read our report that will be coming out this month with more information. So in terms of select characteristics for incarcerated people, I wanted to give some to frame the conversation of what are the basic demographics we know about the population that participated in the survey. So in terms of race, 53% self-identified as white, 21% as Black or African American, and 15% identified multiple races or ethnicities that they felt represented themselves. And so we provided folks, or the local research partners provided folks with a lot more options than these three. And you can see in the report our full distribution of that. And 3/4 of the people who participated in the surveys identified as men. And this makes sense because 4 out of the 5 participating prisons were men's prisons. Only one of the prisons was a women's prison. In terms of highest education attained, 46% had completed high school or a GED, and 23% had completed some level of college without receiving a full degree. People were also asked about their household income prior to incarceration, as well as their living situation and employment. And so you'll see here that 41% reported an annual household income below 20K prior to incarceration, but more than half were employed full-time prior to incarceration. So I think that's interesting to think about the jobs and the income that people had. And we also asked, folks were asked about incarceration history. So a large majority had been in the state prison where they were surveyed less than 5 years. But for their most recent conviction, they had received a sentence, 40% had received a sentence of more than 10 years. In terms of characteristics for correction staff, 67% were white, 15% identified as Black or African American, and 4% were multiracial. And similar to incarcerated people, folks were asked a much broader options of race and ethnicity, and we have more details about that in the report. 53% identified as male, so about half of the population. And about half of staff had a higher education degree, corrections staff. Folks had an annual income, 44% had an annual household income between 50 to 100K. And an overwhelming majority of staff that participated in the survey worked full-time at the prison. So the local research partners really were capturing the perspectives of people who were in the prison full-time. In terms of tenure with the DOC, 38% had been employed by the DOC for over 10 years and 29% between 1 to 5 years. And importantly, these last two facts I just want to underscore, about half of the people who participated in the survey had a security or custody role, and 75% were direct line staff. So they were corrections officers that were working with the population in the prison every day with a security purpose. I'm now going to go through comparing perspectives across incarcerated people and corrections staff. So as you may recall, I mentioned that there were a number of questions and domains that were asked to both populations. And the reason behind that is so we could compare perspectives across these two populations that were in the same environment, but obviously in the environment for different reasons, whether employment or being incarcerated. And so the first of those categories that I'll go through is around the purpose of prison. And so both incarcerated people and correction staff were asked to rate to what extent they felt that it was very important or not at all important, these four purposes of prison: the focus on punishment, ensuring public safety, preventing future crime, and helping people make changes for a better life. And so folks were asked to use this 4-point scale from not at all important to very important to respond to these different purposes of prison. And here are the results, which there are some really interesting takeaways, I think, about this. And so here you'll see that I included just the responses to important or very important, so on one side of the scale, just to reduce it a bit for readability. And so the first thing that I want to point out is you'll see that staff and incarcerated people both agree to the same level around the importance of prisons punishing people for the crimes they have committed. And those levels really don't change across the two waves. Another notable thing from this data is that you see that staff have an increasing focus on public safety, rehabilitation, and preventing people from committing future crimes. And you see how that increases from around the 80 percentile all the way up to the high 90s percentile in response rates across the wave 1 and wave 3 of the survey. And then lastly here, incarcerated people's perspectives largely remained unchanged across these surveys over time, but they did have some slight decreases, but nothing particularly, wasn't big decreases in perspectives. These two populations were also asked about prison living conditions. And so they were asked to rate prison living conditions on this scale of strongly agree, strongly disagree to strongly agree around whether incarcerated people are getting enough to eat at the prison, whether they're getting what they need for good personal hygiene for free, they're usually able to get a good night's sleep, and whether it's easy for people with physical disabilities to get around in the prison. One thing that I want to note here is that the survey questions were adjusted for the perspective of the person who was answering them. And by that, I mean incarcerated people were asked the question, I get enough to eat here, and rate that statement, versus correction staff were asked, incarcerated people get enough to eat here, and rate that statement. And so, unsurprisingly, I think to many of us who work in this space, incarcerated people and staff largely disagreed on the state of prison living conditions. And in addition to that, staff saw prison conditions, living conditions, more favorably than the incarcerated people saw them. And so you'll see some similar trends across these 4 items. For instance, around enough to eat, you'll see that 40% of incarcerated people agreed or strongly agreed that they do get enough to eat, while as 62% of staff agreed or strongly agreed with that statement. And we see a similar trend here too around good personal hygiene. Around whether incarcerated people are usually able to get a good night's sleep, we see a similar trend, this 40-60 split or so across the data and across these two populations in wave 3 of the survey. And with some decreases here in terms of that distribution, but still 37%. So, around 40% agreed, strongly agreed that it's easy for people with physical disabilities to get around the prison, compared to 52% of staff. So we're really seeing a strong difference of opinion across these two populations. As I mentioned in the beginning of my presentation, we also, the survey also focused on prison working conditions and the perceptions of staff who are working in prisons. So I'm now going to talk through some of the findings from the surveys on that. There were a number of questions that asked about safety and well-being and perceptions of those. And so you'll see this first question is, I feel safe speaking up about staff misconduct. And you'll see that this increased over time, this feeling of safety speaking up about staff misconduct. It changed 10 percentage points from wave 1 to wave 3 in terms of folks who agreed or strongly agreed with the statement. Trust among staff also slightly improved. And so you'll see here that for the statement, I feel that I can rely on other staff in this facility. You see this improvement of a little under 4 percentage points, but never less than 2/3 of staff across all 3 survey waves disagreed or agreed that they felt that they can rely on other staff in the facility. The next 2 questions really focused on perceptions of the policies and practices and prisons leadership to keep staff safe and prioritize their well-being. And so you can see here that there's a really tremendous increase in agreement with these statements across from wave 1 to wave 3. In terms of the prison's leadership does everything possible to keep staff safe here, you see a 25 point increase. And then on prison policies and practices supporting staff well-being, you see a 23-point increase. And so the last thing that I wanted to point out here is that we see a positive improvement on all 4 of these perceptions around staff safety and well-being. And we're going to unpack that a little bit in our panel discussion shortly. So despite those positive improvements, stress remained high. And I think this is unsurprising because working in corrections is a very stressful environment, especially in light of the past 5 years with a really significant national staffing crisis that certainly affected the 5 sites that participated in the Prison Research and Innovation Initiative. And you see here, so in terms of responding to my coworkers show signs of stress, there isn't a large change too much across the different waves. People largely were indicating that their coworkers showed signs of stress either often or always. And lastly here, I want to talk about job satisfaction. So there were a couple of questions around job satisfaction that the local research partners asked corrections staff in each of the 5 places. First is this one on I take pride in my job. And you see that pride in their work was pretty high, very high, and growing across survey waves consistently. However, when staff were asked whether they look forward to coming to work, the level of agreement was much lower, with overall agreement reaching around 50% only on the final wave of the survey data, so wave 3. And so I think that those are important indicators, and we're going to be exploring those indicators of job satisfaction more, particularly around for different types of staff, security versus non-security, as well as tenure in DOC, and see if that affects job satisfaction. So I'm going to pause here and turn it over to the conversation to our panelist discussion. And I'm delighted to introduce our fantastic panelists that are going to join me on screen now. So I will give them a second to join. Okay, Great. So our first panelist is Dana Saforek, who is the Missouri Prison Transformation Project's project manager at the Missouri Department of Corrections. Next is Dr. Talisa Carter, who is an associate professor at American University. And last but not least, we have Dr. Abby Crocker, who is an associate professor at the University of Vermont. So thank you everyone for joining me today to discuss the cross-site survey findings. And Talisa, I want to start with you with a question. So from your perspective, working in this space as a researcher who has many, many years of experience, how did the perspectives of incarcerated people and correction staff I just shared align with or challenge existing academic literature about prison living and working conditions?
Yeah, Evelyn, that's a great question. And just to do the thing that we do before we start, I just want to, I'm sure on behalf of my panelists, thank everybody for coming, thank Urban for having us. Really excited to be a part of the conversation. So yeah, so what you just presented, Evelyn, and what the 5 sites found, they really do line up with literature for the most part, right? This idea of that the prison environment is stressful, that living conditions are subpar, not where we would want them to be. I think there are there's plenty of scholarship that backs those statements. The things that perhaps would raise our eyebrows, right, in the academy are the slides where we talk about this improvement for correctional staff and their feelings of being cared for in terms of well-being, in terms of their supervisors and their employment, that facility putting in policies and procedures where they feel safe enough to report the misconduct of coworkers. All of those things point to, that our work, both on the ground, practitioners, academics, right? The work of caring for the people who live and work in prison perhaps is starting to shift, right? That paradigm shift that we talk about often in scholarship. Another thing I think that would raise an eyebrow in terms of the incarcerated population findings is kind of how it lines up or not with the correctional staff. I think perhaps, correctional officers are understudied generally relative to other criminal justice practitioners. But what you'll see is kind of this trend, that this 40-60 split roughly that you presented, that kind of being consistent across categories, I found really interesting. Because one, I mean, just to say it, right, as a professor, a 60 isn't great, right? So it's not like either population was saying, hey, I'm excited about being in this space, this environment, right? I feel like the people that we supervise or the people that I am incarcerated with are, they can go to sleep at night. Those things are real concerns. So I think both populations realizing that, hey, this isn't a great space to be, that's not surprising. But the consistency by which the populations responded to different questions is really empirically interesting.
Thank you so much. So now that we know that conducting research in prison environments is challenging, I think that's an understatement, and you can all attest to the challenges that come with doing this type of work. And so incarcerated people and correction staff require different approaches for research. So I'm wondering if Dana and Abby, you can share about the on-the-ground research strategies to ensure that you all were gathering accurate data and really reaching these populations and engaging them effectively.
Sure. So as we kind of spoke about, we started this during COVID, and that actually helped us a little because I was on the ground and employed by the Department of Corrections at the facility we were doing the research at. So I was able to embed myself into the community, whether it was the incarcerated population or the staff community there. So they would get a little bit of buy-in, or I would get buy-in from them. And so they would trust me. I mean, trust is a huge deal inside the prisons. And just walking in off the streets, coming in, trying to do research is not really feasible. So our approach was I embedded myself into the community. And then after they got used to me being there, it was so seamless to bring in our research team because they saw me as this Pren manager that's going to bring a research team in, and then we were just one unit at that point. They just saw us one in another. So that's how we really focused on getting to all of the populations, because otherwise, had we not done that, we wouldn't realize, that maybe we need to go sit for an hour in a segregation unit with the staff members working there, because they're not going to be able to come to us, that sort of thing. Or going to the offender council meetings and meeting with the people that are leading their wings, or the influencers within the prison population, so that really let me learn the facilities, so then our research team could come in and do the work that they needed to do.
I can jump in. So I was coming in from the University of Vermont, sort of from the outside, and we didn't have super strong connections in the facility to sort of, like Dana was talking about, to sort of open the doors for us in the beginning. So we really relied on spending as much time as we could inside the facility, talking with incarcerated folks and talking with staff to try to find people who would be like, okay, I'll listen to you and I'll talk about it, and try to build those relationships really ourselves. And like Dana talked about, the demands on staff time were very different than the demands on the incarcerated folks' time. And so specifically with incarcerated folks, we would go and sit in their living units and talk with people and just go up and introduce ourselves. For staff, we sort of had to walk around the facility and go to them in their sort of working positions and be there at all shifts. I think not just showing up between 8 and 4 Monday to Friday, but really going to the night shifts and on weekend shifts and things like that, and having a physical presence. And I think that that's what's so essential for making sure that the data are accurate, is because the people inside are the ones who have to look at the data or the survey instruments and say, these are good questions. This represents what we wanted to say. Otherwise, it's research on. And I think that participatory approach is so essential here. And I will say one last tip that we did, because we tried to be in the facility as much as we could, and we were in relatively a lot, but we would wear the same clothes every time we were inside, like the same outfit, so that everybody knew if we wore a green shirt, that was UVM and we were inside. So it was a way for us to sort of have our presence be seen, and then people could sort of know who we are, other than just, who's that person walking around all the time.
That's really helpful to hear you both share those insights. And I know, at least for the Iowa team, which was another site under this project, they even created a video that then was on loop within the prison of them introducing themselves. So then when they came in, people were like, oh, right, I saw you on the video. I know exactly who you are. And you come in at this same time every month and interact with me and reintroduce yourself. And so that helped, build the relationship and build trust, especially with staff when outsiders are coming in particular. So this next question is for all of you. So whoever wants to jump in first. So can you share about how incarcerated people and correction staff well-being are intertwined and affect overall prison culture?
I'll jump in. We looked at wellness really closely in Missouri with the staff and the resident population, particularly on for the residents. They wanted access to food, like better quality food, fresh food, essentially. And staff, they just wanted a place to go after a stressful event. And so what we found was, they are intertwined, because if you don't have a healthy staff, you really can't provide for the resident population. Like, we could have all the great programs in the world, but if we don't have staff to carry them out, what's the point? So they're definitely intertwined. And when you have a healthier resident population, and they're getting what they need as far as programming, and they feel good, so to speak, then it's a safer work environment as well. So that it creates this culture shift to where you can go to work and feel safer, and you're going home feeling better. And the people that live there come out better, so we did find that there's definitely, they're just intertwined. They're one and the same.
Talisa or
It's
Abby,
like
did you want to jump in?
But at the same time,
It's the
so
race to the
just-
mute button. Okay. Yeah, so I completely agree with what Dana said, right? It's like this really critical feedback loop, right? And so, in a healthy system, you would tend to both sides. And I really love this question because so often, particularly in scholarly research, which really revved me up when I first, started my journey about being an academic, it's like this idea that, we do research in these spaces, but we really only think about a part of the population, right? One stakeholder group. And so inevitably the other side gets neglected. And when this us versus them kind of equation or this model that's really plagued law enforcement for such a long time, right? And it's not just law enforcement, right? Professor and student, right? Faculty and staff, tenure track versus non-tenure track, right? I'm sure, hourly versus salary employees, right? We see this so many times, these parallels, right? And what we've learned in organizational literature, right, is that you really need to take care of all parts of a community in order for the community to be its healthiest. I will say that sometimes, realistically, we don't have the capacity to take care of both sides in the same ways. But I do think at least, as scholars, as researchers, as practitioners, the least we can do, the starting point is transparency. Because what I find kind of doing this research through Delaware, my visit to Vermont, is that when people feel like they're a part of the community, even if it's just information sharing, that can increase the health of an environment, including policies and practices within an institution. So often it's just like, yeah, this rule got passed and it looks so much different on the ground because no one actually knows where it comes from, exactly how it's supposed to happen, et cetera, et cetera. So yeah, I think it's a critical feedback loop. And you just have to take care of everybody in the community.
Yeah, I'll add that I just echo that, the ecosystem approach seems essential. Like the facility is, such an ecosystem. And you think about, I picture the staff who are working 16-hour shifts. Like that is so hard for them. And it translates to the folks who are in their care. And I feel like that's one of the I'm sort of skipping ahead to a question, but I feel like that's one of the things we really learned in Vermont is this empathy cycle between both incarcerated folks and staff, and really how the health and wellness of staff influences the health and wellness of incarcerated folks and vice versa.
I'm curious, and this is not one of the questions that I mentioned to you all ahead of time, but did you all find that the pre-project help strengthen that understanding of how this well-being is intertwined with one another?
I'll say yes, strongly yes. Definitely our surveys had a lot of health and well-being measures for both incarcerated and staffs. And then when staff could read the incarcerated folks survey results and incarcerated folks could read the staff survey results, it created more awareness, more empathy, more like, hey, we're all here together. Let's improve this system.
Mm-hmm. Great, thank you. So the discussion today is mainly focused on the climate survey findings, which I presented on. But there were these innovations or changes that were made on the ground in response to the climate survey findings in each of the sites. And so I'm wondering if Abby and Dana, you can talk about the different innovations and changes that were in response to the climate surveys in Vermont and Missouri. And maybe Dana, let's start with you and then to Abby.
Yeah, so two of the big ones that we did, it was around health and wellness, like I mentioned. The residents wanted access to fresh vegetables. So we have gardens that grow vegetables to be donated out to communities, but they asked if they could purchase from the garden, and then the money that was made off of it would be donated back out to the community because they were adamant that they didn't want to take away from the community. And we jumped through all those hoops with our central office and was able to make that happen for them. So they're continuing to be able to purchase these vegetables. And I think other facilities in Missouri have, not all of them, but some have picked up that practice as well, which is fantastic. And then for staff, we just didn't really have safe spaces for staff, so to speak. So there were maybe a staff lounge here or a quiet space there, but nothing that was really uniform. So we created a decompression space that was more of a place to go before shift, after shift, during shift, where you needed to get a minute away from prison. that had, we were very intentional. It was softer lighting, softer textiles, curtains, colors that you wouldn't see inside a facility, different lighting, and massage chairs. And that led on to providing hygiene items in case someone needed to take an emergency shower, or had a tough day and not going to make it home for a shower, so I'm going to shower before I go to my child's school program or something, that sort of thing. So we really tried this holistic approach to just give our staff more. I mean, we didn't have a lot of staff, but it's like, what can we do for you? How can we help you? So those were two of them. And then just the method of talking to the staff and residents is an innovation in itself. Where we have these two groups where we work separately, but then there's times when we bring them all together and work together and come up with solutions. Or maybe something's not working with one of the groups and we come together and say, well, it's not working because of this. And then we fix it or work through it. And then another, just a byproduct of this initiative that we did, is the Missouri Prison Transformation Project, which is a project where we're taking wings in 4 different institutions in Missouri and bringing a normalcy to those wings. And when I say that, it's physical changes, we're giving staff additional training. These wings are not for honor status people, it's general population. And we're like using community engagement, bringing outside people in or within their own community, peer-led classes. So this is all encouraged through this project. And we got to this project through the research we did at the Moberly Correctional Center, because this is something that the staff and residents both were asking for. And we were able to secure an additional grant to continue this work.
I think in Vermont, sort of one of the sort of side effects of PRIN has been the recognition that how helpful transparency is, that by opening your doors to new folks and bringing people inside, you can question the way things are being done, so that it sort of gives partners in change processes. And that we've seen play out. Changes that have come about, like sparked and spurred by the PRIN data. There's big focus on increased resources for staff wellness, really highlighting some of the staff health and well-being challenges that came out of the surveys. And a lot more investment in community partnerships to provide some services from those community-based organizations inside facilities. And so relying on the expertise of community partners to come inside to sort of create that bridge as well. So there's statewide expansion of peer recovery coaching services inside the facility, a new partnership with the Community College of Vermont to offer post-secondary education, an expansion and investment in restorative justice services to really come inside the facilities, to really facilitate that handoff to coming out of the facilities, and more. And so I think, and those are sort of the bigger kinds of things. And then on the ground in the facility, there was an honors unit that was put in with like an indirect supervision model. There was a new coffee shop that was put in the facility, which is a very, very cool space for folks to come together. And it's managed and run by the incarcerated folks, but a place for staff and community partners to gather. So those are like the highlights. We've had some failures too. So I want to just acknowledge that very clearly, but these are some of the big things that are coming out. And what I'm excited about is it's opened the door for more. So I really appreciate PRIN and PRE for that, because it really helped us get through sort of a big chunk of time that was, relationship building, foundation setting kind of stuff.
Yeah, thank you both for sharing. And I think something that you're alluding to, but that we'll talk about more at the webinar next week, which is focused on the process evaluation, is that the approach of PRE was innovative in and of itself. Doing participatory research in prison has been done, but not done a ton. And so this was building on it and building a cohort of researchers who wanted to do that, DOCs and prisons that were willing to open their doors and engage with this, and then use that information to drive decision making. And so we'll be talking more about that next week at our second webinar, just to plug that again. But that certainly felt very innovative for this project. And so I want to pivot a little bit into thinking about moving forward. So everything we've learned from this project over the past 6 years. And so, Talisa, this first question is for you because your research has focused a lot on the experiences of corrections officers. And as you mentioned before, they're a very understudied population in research. Oftentimes research focuses on the incarcerated population and ignores the staff that are within the facility. And so can you share from your perspective what you believe are the most pressing research questions around prison working conditions and where are the research gaps?
Yeah, it's a great question. So my whole life's work right here in this moment. So I'm going to talk about two things. One directly related to the slide you presented, Evelyn, which is the disparity between how much pride correctional officers take in their work, right? And then how little they look forward to coming into the job every day, right? And I think kind of most pressing is attrition and the staffing crisis, right? With correctional officers in this country, vacancy rates can go as high as 48, 52% in some states and some facilities, unfortunately. No one wants to be a CO, right? And so it's interesting that, the sites found that a lot of COs really take pride in their work, right? But the sticky point is how can we translate these points of pride to retention, right? And then how can we also leverage these things that we know bring pride to the individual, right? To recruitment, right? And to making work not so terrible to go into every day, right? Now, granted, sometimes that number is going to be that number, right? Who wants to go to work every day, right? There is a baseline of, I don't want to have to do this, right? Every single day for any job, but we know correctional officers have some of the most stressful jobs in the country. And so I think the retention, the staffing crisis continues to be the most pressing thing, especially when COs see themselves as capable, right? Capable, efficient, effective in some studies, right? And also in this study, prideful, right, in their work. And then the second thing is this idea generally just in the work and kind of something that I just really am passionate about is this idea that training fixes things, right? So this expectation we have of correctional officers to be Jacks and Janes of all trades, right? They have to be counselors and therapists and mental health workers and social workers, but also protect the security and safety of facilities, right? And so in scholarship and often in policy and practice, we see correctional officers as either parts of the problem or parts of the solution, right? There's kind of a very polarized way to look at that population. I argue that they need to be a part of the process to get to both of these things, right? Instead of just bookending them. It's what are they experiencing and how do those experiences kind of create mechanisms in facilities that lead to certain outcomes, both positive and negative. So I would say those two things around training and the staffing crisis are really pressing right now.
Thank you for sharing. And it's something I just wrote down what you said, part of the process. And really that is what it is. And so much for me working in this space has been realizing that when you talk with line staff, they don't feel a lot of agency. And incarcerated people think they have a lot of decision making and a lot of agency when they really don't. And, I think really understanding those nuances has been really an interesting part of this project. What we assume about the other population and what we learn through this data of what they're really thinking and how they actually feel in their position. So Abby, you're approaching this work as a trained statistician. That's your background. Can you talk about what you see as the methodological gaps in current research on prison living and working conditions, and where do we go next to fill those gaps?
I so appreciate this question. Love that we get to talk about statistics. And I've been thinking about this. There's sort of three things that pop to mind for me. The first, I think, is the participatory, the community engaged approach to research. So essential here. And I appreciate, that saying that's innovative here, but it also, like, the folks inside have this expertise. They are part of the process. And And so I really, really think that figuring out how to build those relationships, manage those relationships, and maintain those relationships so you can be as authentic as possible to a participatory, community engaged approach in the facilities is really important. And I mentioned sort of at the beginning, we had all these challenges with getting inside the facility, but now I would say our commitment to that approach means we have an awesome partnership with people inside the facility who are, I don't think we could make change without them. And so I just think that's a really important piece. And so that would be about the approach to research. I also really think we need to think about corrections change as totally interdisciplinary, stakeholders everywhere. Oftentimes you see corrections-based research focused in departments of criminology, but challenges of corrections and the ecosystem around them span all disciplines. And so really trying to think about sort of the challenges and the opportunities and solutions with corrections as this interdisciplinary approach. And methods are a great way to bring people together. A great way to bring people together. And I think that's one of the benefits of this survey is, that we have data that are trusted by the folks inside, data that are trusted by leadership and change makers. And so it really helps us ground a conversation. So, and bringing in new folks to the space. And then the final thing I would say is really thinking about how we measure the success of prisons. We tend to take measures of system failures and success and assign them to individual behaviors. And I think recidivism is a big one of that. And so I would strongly advocate that we reconsider the measures and what measures that matter in terms of looking at sort of the system and then the individuals who get caught up in the system as well.
Thank you. Yeah, I just wrote down what you said around the system failures assigned to individuals, because I think that's really spot on. And so often we do go to that metric of recidivism, but recidivism isn't what's happening in prisons today related to living and working conditions. It's a different type of metric. And so, yeah, it is interesting to think about how do we redefine those measures of success and what are the measures of success that are most important to people who are living this day to day, the correction staff, the incarcerated people, the wardens in these facilities who are working in these systems, and this is their livelihood and how they're spending their daily time. So Dana, as a question for you, you were the conduit between the research team and corrections. And so you were helping them work with one another and build this relationship. What do you think the field still needs to learn about forming these types of partnerships across researchers and Department of Corrections?
I would say one thing is kind of hitting on what Talisa said a little, like Department of Corrections oftentimes are just like forgotten members of society, the staff and the residents. I mean, we're tucked away and unknown. And I think that's something that we as correctional staff have done to ourselves a little. Like, we need to be out in the communities a little more, and we need to make ourselves a part of the communities, because in Missouri at least, our prisons are the largest employer in a community, or we're a big part, but nobody knows anything about it. And I think that deters people from really wanting to even be inside or understanding why it's important to do the work. And I think if we can be out in our public and our people see why it's important, then it's going to open more avenues for the research to come in and open more partnerships, because by being so closed off, people just really don't understand why is it important to even research the prison culture, whether you live there or work there. Because this is something that we've said over and over through this project, is everybody in prison is somebody. And whether that's you're living there or just working there, I mean, it's still like important, and society needs to understand why it's so important for research to happen inside these prisons. So that if we can get the community support, then I think it opens even more avenues for researchers such as Abby to come in, and our Mizzou partners. And then once we have that desire to do it, think bigger than what you have already been thinking, and be open-minded to what can happen. Because I mean, this is kind of jumping ahead, but I think that is probably one of the biggest thing that we've learned is go ahead and ask for the big things, because you never know what you're going to get, and think outside of the box. And just because it's been done this way doesn't mean it has to be done this way. So thinking in that broader term and that not all bad things come out of research. I think that that's something that we think that if research is happening, then there's something, bad that's going to come out of it. But there are good things coming out of it too. So we're seeing some positive results on stuff that we didn't even realize that maybe that we thought may have been negative or whatever. So being able to have those doors open just for the communication and getting a couple people in to do a little research is we found is leading to more and more and more within our own state.
Thanks so much, Dana. And yeah, I would love to put that on a t-shirt. Not all bad things come out of research, and that research is really a powerful tool. It's not just identifying the issues, but it's identifying the successes. It's identifying pathways forward to make productive and effective change for folks. And I think you're right. Oftentimes people get skittish around research or think, okay, they're just going to identify everything wrong that's going on with me and don't think about the potential benefits or how it really is a tool for particularly corrections administrators to be able to use to change their systems. And so I had one last question, and then we're going to pivot to audience Q&A. So I encourage people to submit their questions in the Q&A chat box that we have available at the bottom of your screen. But before we pivot to Q&A, could you each share one research finding you learned under this project that challenged your assumptions about either prison living conditions or prison working conditions? And I know, Dana, you started to talk about this, so maybe let's go to you first.
Sure. Well, I mean, honestly, some of the findings that we got was the surveys backed up, but it was through our innovation advisory meetings. And so something that really changed the way I look at both the staff and resident population is when we were working together, they were very concerned about how like doing one innovation for this group, how it affects this group. So I think that is something that we weren't expecting to see how, and for instance, with the garden, that was quite the undertaking, but the residents really wanted it, but they were very concerned about how that would affect the canteen because that's where it's sold through, and how's custody going to be able to supervise. And so I think that is, we didn't really realize that they put that much thought into what burden, their term, something like that would be on our staff. So that was pretty eye-opening. And then the same with the staff. They they had concerns about some of the innovations that we did. But one thing that we did learn through the surveys was how it's much easier to provide the innovations that we did if we do that from a balanced approach. So we would do one innovation for our staff and then one for the resident population. And the buy-in that we got from that was huge, and they wanted to continue to do more. So we as a department didn't realize, or that institution particularly didn't realize how much each population was paying attention to those sort of things. Does that make sense? Yeah, very intertwined.
Abby, do you want to go next?
Sure. So I think for me, not being working in corrections, but partnering with corrections, and this project really designing to create and foster transparency and shine this much needed light on the corrections environment means there's not like one thing that I've learned. I've just learned everything and continue to learn every day. And I think that's the relic of these being such closed systems. And I would say that one of the things I notice is just the ripple effects of that closed system that we see every day, and just this, even how the small processes, it's always been done this way, but there's just a lot of like quality improvement opportunity and just sort of operations, but that's really challenged by the closed doorness of the facilities, as well as staffing challenges. And I just think I just really need to highlight that ecosystem approach of the staff working 16-hour shifts and the impacts that has on them and their families and their communities and their lives, and then the impact that has on the services and the resources and the attention that can be paid to improving conditions inside for the incarcerated folks. Just how challenging it is to address that is something that that really, I would say, is a huge takeaway and a big future direction for the work.
Talisa?
Yeah, so I think for me, the thing that surprised me the most is how much the perceptions of staff improved from wave 1 to wave 3. That floored me because I think that there comes a time when you do research a lot, when you especially organizational research, you kind of accept the slowness of change. Like it comes with it that this is going to be a project and it's going to take a while. And so I was really surprised that, for example, the largest change that you presented, Evelyn, today was this prison's leadership does everything possible to keep staff safe here. And I mean, there are two ways to interpret it, of course, always multiple ways to interpret anything. Is everything possible, right? Like, hey, there's an expectation that I won't be safe at work. But also there's a positive way to look at it, that over the course of the project, right, the transparency, right, the efforts made, the innovations made had so much impact that staff really feel that they're being led by people who care about their well-being. And it might be idealistic to interpret it in a positive way, but I do think it's astounding and hopeful for both scholars and practitioners that you can make such a change in a single project, because perceptions in social science, perceptions shape reality, right? They are a lot of times the realities that we're contending with. And so I was really hopeful, but happily surprised by the change made.
Great, thanks everyone for sharing. We have a number of questions that have been asked in the chat, and please continue to submit your questions. We'll continue to filter them on the back end, but I'm just gonna start with a couple that I have compiled here. So one of the questions was, how did we select sites to participate in this initiative? This was actually an open request for proposals, and so we invited any Department of Corrections in partnership with a research partner and an identified pilot state prison to submit an application, and we kept that open for a while. And so then we selected states based on a set of criteria that was outlined in the request for proposals. So that was open to anyone who wanted to apply. And then there was another question on how did we develop survey questions? And I'm going to answer this first from the cross-site survey questions, but then I'll invite whoever from the panelists want to jump in on this. But in terms of the cross-site survey questions, we did a pretty extensive search at the Urban Institute of previous surveys that had been completed with incarcerated people and corrections staff. And actually we compiled, it was definitely over 250 questions. It might have been over 500 questions across both populations. We still have that list if anyone is interested in receiving it, so you all can use it. But of prior research and prior survey questions that had been asked to these populations and sorted through them that way. And then we went through a process of identifying which ones seemed most important for sites to include and for us to understand cross-site trends. And then I don't know if any of the panelists want to talk more about the participatory research approach around the rest of the survey questions.
I can jump in because I feel like this is definitely where the bulk of my time was. But for us, we formed research council partners with staff and incarcerated folks so that we could help like sift through questions and ideas. But really, we talked to anybody who would talk with us, staff and incarcerated, about what do you think we should include in this survey? What do you measuring prison climate mean to you? If you were to develop the survey, what needs to be on it? And so we did that by, walking around the facility, but then also in a much more structured way with focus groups and interviews, and then went through all of those data and formed research questions, and then really fine tuning of the research questions, or knowing where to look for existing validated instruments and bring them into the survey instrument itself. We worked with our research council partners on that. And I actually think that's why, like, we were very, in Vermont, we developed a staff and an incarcerated folks survey that had over 150 questions on each. Like, we really came into it thinking we only wanted 30 questions, but our partners inside were like, this is what it actually means we need all of these questions. And they really helped us with the order of the questions, the wording of the questions. And I think that has led to some of the success in, we've high really response rates on the surveys of over 70% for staff and incarcerated. But I think the thing that is most impressive to me is high completion rates. So with these super long surveys of 150 plus questions on each, we have completion rates of over 95%. So people are taking the surveys themselves. So that partnership in the development was instrumental, I think.
Great, thank you. I am going to pivot to our next question. And so, Talisa, this one is for you, and then others can, of course, chime in. But we know correction staff are often asked to participate in research a lot, by times over surveys, and they may be hesitant or resistant to participate in research. And so how do you improve correction staff buy-in and response rates for research? How do you reach this population?
Yeah, that is a great question. I will I'll preface this by saying that I worked as a correctional officer in Savannah, Georgia. And so my personal approach is really one of kind of peer-to-peer, because I go back to facilities often, and I still tend to use language that maybe academics don't use, right? I was socialized in that space. And so that's how I approach it. But generally, what I find is very effective, and I have to, of course, shout out the University of Delaware for this, and the Center for Drug and Health Studies. This idea of when you build rapport, right? In order to build rapport with a place, one, you have to be open. And I think that oftentimes, right, in academics, I mean, we all do it in classrooms, as we go, it's kind of like, I am the professor and you are the student. And that is just never the right approach to build a relationship with any organization, to do good research. But then secondly, like, it's really language. So for example, the shift that people are making, not just academics, but practitioners too, towards, person first language. Dana said resident on this call, right? But whatever facility that you're at, you should really meet them at the language space and then have conversations around language, because language can be exclusionary, right? When one person is imposing language on a space. So like little things like that, not little, but like things that we might consider little, like that helps build rapport. Also consistency and showing up. So what Abby said about, wearing the same color, but also Evelyn, what you mentioned, which is people coming the same day and the same time, right? Is you can't just cancel class and be like, oh, I'm not coming in today, and everybody's happy about it. You have to show up, right? On time, all these things that kind of create consistency and build rapport in a relationship. I'll also quickly just say, in order to build rapport, I think the difference between students and this, and I'm big on this, is not expecting trust, right? And earning it, right? Earning trust. And so I also think trust is the wrong word. Maybe it's not trust. Maybe it's just a healthy and collaborative relationship. But whatever you're trying to build, don't expect it. You earn it. Right. And that really encourages people to show up well in the same pace. But it's hard, right? CEOs, and I am still very cynical of systems. I'm cynical of research, even as a researcher. So it's hard, it's difficult. Don't be discouraged by low response rates, but I do think we have to challenge ourselves to be more open and earn it. Whereas on campuses, we might have already earned, right, our positionality.
Anything to add to that, Abby or Dana? If not, I'll go to the next question.
I just want to add a tiny thing. I mean, even though I had been a DOC employee for years and I walked into the facility I walked into, they were not excited to talk to me. And I was a DOC employee. It wasn't until I jumped alongside them and started relieving them to go on a break because of staffing shortages or working side by side that they were even willing to talk to me. So, I mean, you are so correct about the trust. It really, it's so important to be seen as one of them and not just someone coming to do work on them.
And Dana, while you're unmuted, this next question actually, I was wondering if you could answer it. So how did you, and then Abby, please feel free to jump in as well, but how did you all share results with incarcerated people compared to corrections staff? And what happened when you shared the results? And were there any challenges with being allowed to share the results?
I will say there were no challenges. I mean, other than technology, I mean, technology inside prisons isn't always fantastic, but we created multiple methods of sharing results because that's the nature of what we're dealing with. For the residents, they said, send me emails. Like, we're always checking our tablets, communicate everything through an email. And we're like, oh, well, that's super simple. In addition to that, though, we did some like little video type infographic type things that would go on their channel so they could just play it on the TV in recreation or whatever. With staff, they're like, yeah, who has time to check email? So we did flyers, and I mean, we did email, but we did additional things like posters and a lot of it was just walking around and having our results in our hand and say, hey, do you have a minute? Like, you want to read this type thing, or being at lunch, being at different places, being at shift change where they're just kind of waiting for a minute and they're not going back on shift yet, but they're just in the lobby. Well, here, read this for a minute. Well, let's talk about it. So it was just being available and meeting the needs of all the different, the people that are living and working in the environment.
I think we did something similar. We created full survey reports, and we're really grateful for our collaboration with our Department of Corrections, who has supported complete transparency and independence in the entire process. So we're all committed to everything that we collect, we share out completely. So we created full reports that have both the staff and incarcerated folks survey results in them. In those reports, and then we put them in every staff person's mailbox, and then created a poster and put that on the wall, right by where all the staff walk, and then had an opportunity for staff to give feedback in sort of drop-in chat sessions as well as written feedback, just to help us understand the results, anything that's alarming or anything they really want anybody who's interpreting these results to really know. So offered those feedback opportunities. And for the incarcerated folks, we put the full reports on the tablets, but then put posters up in each living unit with some of the highlighted areas. And again, offered the opportunity for folks to share feedback in writing or in conversation. And what's awesome is sometimes when I walk around the facility today, we still see those posters up on the walls in those units. And so it's nice that they're still there, and that it means something.
Great, thanks so much, Abby. And I was wondering if you could just spend our last minute of the webinar, Abby, briefly talking about how you publicized the results and made them publicly available.
Yeah, so we took those reports after we shared them with everyone in the facility first. We worked with the Department of Corrections to create a press release. And so we did a press release and shared the reports with anyone who would listen. And the reports themselves are on our website as well. So I think that's an important part of the process. And then anybody who wanted to talk to us about them, we were more than happy to go and talk with folks. So we would go to our legislators and talk about the results in the process with different state agencies, different organizations. And with how much went into it, it's also thinking how much more needs to be done. So all the other avenues and how much more needs to be done with these data, and how much we actually want our partners inside the facility, our staff and incarcerated folk partners, to actually be part of that dissemination process with us a little bit more. So I think that's also part of our future directions.
Great. Well, thank you everyone so much to our panelists and to all of our attendees for coming to our webinar. As a final plug, we have a webinar at this time next Thursday, September 11th. So we welcome you to join. We're going to be talking more about the process evaluation of the Prison Research and Innovation Initiative. And both of our reports on the climate survey results and the process evaluation results will be released this month. So please stay tuned for that. And if you have any follow-up questions, you can reach us at transformprison@urban.org. That is our email address. So thank you everyone again for joining and have a great day.